Welcome, everyone. I'm Basil Kaki, and joining me today are my esteemed colleagues and experts in TRT management. Thank you all so much for being here. Today, we're going to be playing a fun interactive game called the Testosterone Fishbowl, where we're each going to take turns at random, pulling questions out of the fishbowl and answering them on the spot. By combining insights and perspectives from several different APP experts, we want to give you practical takeaways for managing testosterone deficiency in real-life practice. I think we'll get started. Charity, would you like to have the honors of drawing the first question?
Sure. First question. What's harder to manage, low T or high expectations? High expectations, for sure. It's not, testosterone replacement therapy isn't a cure-all. So I think if a patient comes in thinking that, oh, this is going to fix all of my problems, my relationship problems, my weight problems, my cognitive issues, it's more than that. So
yeah, well said. I agree. I think one of the big misconceptions is patients come in, they expect testosterone to cure everything on its own. And an analogy I'd give is, say you have two patients, they come in, they both have low T. Their levels are, say, 250 nanograms per deciliter, same low testosterone level. You choose the same therapy for them. Say you put them on testosterone undecanoate, 237 milligrams BID, same dose, same levels. Patient A goes home and he's optimizing sleep. He's getting 7 to 9 hours of sleep every night. He's exercising 5 times a week. He's eating very nutritious diet, mitigating stress. Patient B goes home and maybe he's sleeping 4 to 5 hours a night. He doesn't exercise. He's kind of eating out a lot. Those patients will come back and have two very different experiences. Mm-hmm. So I think when patients expect T to fix everything, I think we all counsel that testosterone is just an adjunct to lifestyle modifications on its own. It's not everything. So I agree.
Next question. Libido, energy, or muscle mass? What do patients care about most? I think this really depends on where they are in life. Younger patients have a different set of motivations than some of the older guys. And sometimes it's hard to tease that out. They're looking for a solution. Maybe this is a fix all. It's not always that way.
Yeah.
And going back to the expectations, it's really important to set up expectations. We can work on all these at the same time. It's not that we have to just focus on one symptom that we want to treat, but caring about the most, it really depends on where they are in life and what their lifestyle is.
Yeah, well said. In my practice, fatigue is the number one complaint I see. I think it's a little bit of a misconception that guys get on testosterone therapy for the anabolic muscle growth. Yeah, there are those benefits, or for libido, and it has been shown to help with sexual function. But for me, it's the guys that come in that just say, I'm tired midday. I can't play with my kids because I'm exhausted at the end of the day. I have no desire to be with my spouse or to be intimate because my libido is low. Usually it's just more of an energy vitality thing than just a muscle mass thing. I think that's a misconception. Yeah.
Sure.
I think, the libido and the ED sometimes will bring them through the door. But then it's surprising how many guys really get that benefit of energy, right? They get that daytime fatigue is gone. Their brain fog is gone. Sort of these minor symptoms, but they're really profound. And they really notice the difference there, and they end up that's the thing that really changes their life. And once you have the energy and all that, whether it's the testosterone or just having more energy, the libido tends to come back. Sometimes the erections come back. Their ability to exercise comes back, and it can be life changing.
Yeah, I agree.
All right, and the next question is, what is your quickest way to explain low T to a patient? This is something that I always start out when the patient comes in and want to know if they have a low T. So we start out by just talking about how do we diagnose low testosterone first. And it's not just the symptoms. We do want to know what their value is, because we know that symptoms of low testosterone are not unique to low testosterone, and there can be many other medical conditions that they may be suffering from. So we want to really have both. We want to have low value, so some clinical indications, but also symptoms that would coincide. And that's a classic diagnosis and what our guidelines recommend to do. So we discuss that we initiate with lab work. We want at least two consecutive numbers before 10 in the morning, and they need to be below 300. And in addition, we identify some symptoms that they may have. And I also like to prioritize with patients. They a lot of times come in with a lot of symptoms, and I like to prioritize and say which one is the biggest problem for you. Not just something they read online about what it could be and say, oh, maybe I do have that too. So we just don't throw it into the whole list. And then we try to work from their list and down and try to identify what other things could be causing their symptoms. So some additional labs, which we may talk later about, that we want to evaluate.
Yeah, that's a really good point. You know, they usually, men with low testosterone will come with a long list. Erectile dysfunction, low libido, difficulty losing weight, mental fog, fatigue, sleep disturbances. I mean, it is a long list. And I love that you tease that out and you ask them, you know, what is most important to you? What's the reason that you came into the clinic? Because I really think that helps tailor the way you treat them. Yeah, well said.
What part of TRT management is most satisfying as an APP, and what truly brings you professional fulfillment in this area? I think that, you know, in a big urology practice, treating all the different diagnoses that come through the door as an APP and not as a surgeon, this is one of the most profound ways we can turn someone around 180 degrees. You know, I treat a lot of incontinence, right? And if you can get a guy to go from 12 pads a day to 8 pads a day, it's good, but it's not the same as, you know, changing someone's life completely. Now, this is the equivalent of going from 12 pads a day to 0 pads a day for a lot of guys, right? And so testosterone is just such a concrete way, and it's very gratifying as a professional. Anyone else? What brings you fulfillment?
I really like to see the whole patient family dynamic change. When the man comes in, he has no motivation, like you said, not playing with his children. He's not making very good decisions at work. He might be a little bit more irritable. His boss doesn't appreciate his attitude. All of the things that go with low T symptoms that they don't even know are going on, and they come in, they get treated, they come back, they're like, my whole entire life changes. My wife is happier, my kids are happier, I'm making better choices. The whole community changes in the family as well as the work environment and the community of their own hometown. So I really like to see that entire dynamic change over time. And my patients in my clinic are very appreciative of just the little things that happen with time.
Absolutely. And I think one of the unique perspectives we all share as APPs is we get to see these men when they're truly hypogonadal. Their levels are very low. And then we see them at follow-ups, and then we see them for the rest of their lives. And the change is just so dramatic, and it's amazing. My personal favorite visit is that second visit. Once you start somebody on testosterone, I can't wait to get in the room and hear what their experience is like, because you have those men that said, it's like a light bulb went off. And I just feel so much better, and thank you. And those are the patients that keep me coming to work, because that's very fulfilling. I mean, we really all got into medicine because we wanted to make a difference. And through the channel of hormone therapy and optimizing that, I can't think of a better way to improve somebody's quality of life.
And we also have more time we can spend with our patient. Our colleagues, our surgeons, are more focused on surgery type of cases where hormone replacement therapy is a perfect opportunity for us to get involved, because we can spend the time, we can really understand what the patient's symptoms are, what their goals are, and really guide that practice and that treatment specifically and customize it for them.
I really appreciate and encourage when their spouse or partner comes in, because I'm going to get the truest evaluation of what's going on with them, you know, when that happens. And when their spouse comes in and says, hey, I've got my husband back, or I've got my partner back, that's significant.
It is significant. And sometimes you get the reverse effect, where you start a gentleman maybe in his 60s or 70s on testosterone, and now he has the testosterone of a healthy 20 or 30-year-old man. And then he comes in with his wife, and his wife is sitting there like this, like, what did you do to my husband? He won't leave me alone. And what about me and my hormones? So I think that may be something else we can discuss in a future segment, and, you know, more on the female side of things. But okay, question is, what's your biggest advantage as an APP in managing TRT? It's simple. It's time. As APPs, we have more time. If you look at the most recent AUA census, the average urologist only spends about 17 minutes with a patient. So that's just not enough time. You know, as an APP, I usually leave my clinic slots to 30 minutes. And I think it's important, because the more time, one of the highest predictors of satisfaction is the time you spent with the patients. And I think, if you look at your patient satisfaction scores, they're very happy when you spend more time with them, obviously. So that would be my biggest advantage. And then you also have more time to discuss all the different formulations, gels, injections, pellets, oral therapies. Many patients are not aware of these therapies. Many physicians or urologists may be too busy to go over each independent one and the risks and benefits of each one. So I think that's a big advantage. Time gives you time to counsel, helps you establish rapport and trust.
If you could pick one thing you wish every patient understood about TRT, what would it be? There's so many. I think I've already discussed this just a little bit, but one thing I would pick is that they need to understand there's lots of moving parts. It's not a cure-all. It's not going to fix everything. You have to put in the work for it. That would probably be the one thing that I would want every patient to understand, that I'm not going to fix every aspect in your life, but we can definitely try to make things better. And hopefully nothing goes negative in the realm of that. So
I always tell patients this is not something that's going to happen overnight. And hormone replacement therapy is involved. It is very involved, especially in the beginning, from establishing the diagnosis, finding the right treatment for the patient, making sure they're compliant, because in order for them to get any benefits, they need to stay compliant and consistent with this therapy. So I give them a warning. There's going to be lab work. You need to feel comfortable and be able to follow up on the requests. When we change the therapy, we may need to get additional labs, and importance of following up consistently. You can't start testosterone and then not come back for a year or not have any labs, because there are important safety labs that patients need to follow. So before they start, I outline to them what a typical follow-up may look like, and make sure that they are aware of what they're signing up for. It's not just once a year you take a cholesterol pill, you check labs once a year, you're done. Yes, eventually you do end up finding the therapy that fits, and then it's just cruising. You're just checking the labs every 6 months, touching base once a year every 6 months. But in the beginning, it can be very involved.
Patrick.
For me, probably the biggest thing I wish every patient knew coming in is that testosterone replacement will suppress the hypothalamic pituitary gonadal axis, right? And so once I start you on testosterone, your natural endogenous production is going to go down, theoretically way down. And so if we stop you, especially if you've been on it for a prolonged period of time, you're not going to go back to your baseline level of mildly hypogonadal, potentially. You're going to go way lower. It's going to suppress spermatogenesis. So younger guys, there are a lot of guys out there on testosterone who were never properly counseled, and they come back, now that they're wanting to start a family 10 years later, and they're surprised to find that they don't make sperm. And so there are some protocols that we use to reverse these things, but they don't always work. And so I think it's important, especially for the younger guys, to know that, and then even for my older guys to know, when they're sort of borderline and we're wondering, okay, your symptoms are there, your numbers are borderline. Before I start you on this, you need to understand that we're going to do a short trial, because a short trial is not going to suppress your levels too much if we want to stop you. But you really need to think, you really need to evaluate, do I feel better? Did this make a difference? Because if it didn't, let's stay off of it. You've got enough testosterone to run the ship and to keep things going. And if it's not going to be of benefit, putting you on it long term is just going to do more harm than good.
Well said.
I really like to present it as saying this is a tool, not a crutch. I want them to use the testosterone therapy to enable themselves to live a better lifestyle, or to supplement their ability to exercise, or interact with her, as opposed to just using it to get along. I'm wanting them to use that to move forward in life and help them make changes to
be a better version of themselves.
Right.
Yeah, no, that's well said.
And testosterone is not, I'm sure you guys get that too in your practice when patients come in and say, I need testosterone supplement. It's not supplementation. I tell them there is no testosterone supplementation. It's a replacement. We are completely suppressing your testicular function. Now, like Patrick mentioned, you get exogenous form of testosterone, a source of testosterone. So you need to really understand that this is not just playing with the pills. Yes, we can start you. I would agree with you. I do the same. Start you initially and see if some of your symptoms will improve if we correct your levels. But if they don't, is it worth to continue something and be so committed to the process if you're really not seeing the benefit? Because I don't see how compliance will be there if they don't see the benefit. We don't want them to just look good on paper, just their levels.
And that's actually one of the AUA guidelines on testosterone. If a patient's been on it for 3 to 6 months and doesn't experience any symptomatic improvement, it's okay to discontinue testosterone at that point. So, all right, we have our last question for Mr. Scott.
What's your favorite success story that you've seen with testosterone therapy? It's going to be the people that come in and say, hey, this changed my life, or I'm back to being a man again, or I feel like my old self.
Yeah, absolutely. I know many of you can also share this experience, but we've had a lot of patients come in. Just show of hands, have you ever seen a patient that's azospermic, zero sperm, he's been on testosterone and didn't know that testosterone caused infertility, right? We've all seen that patient. So for me, one of the most satisfying is putting those patients on a reboot program, whether it's with HCG, FSH, or enclomiphene, and help them start a family. And when they send you that picture or they bring in their newborn, that will never get old to me. I think that's always very rewarding and fulfilling.
I love to hear stories from the partners when they say, I have a couple, and the wife told me, I have a whole new husband that I thought I lost. And now their whole relationship got a total revamp. They're traveling, they're exercising together. They're just so much happier. The sex is better, all of it. And they just happy. And we love just when they come in, we just share their new experience, where they went, what they did. And it's just a total turnaround for them.